Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. When we implement comprehensive EHRs, we have a lot of benefits. We have all of the patient information in one spot. We're able to, from any computer terminal, log in and see all the information about a patient and also verify inpatient orders. This is something that has been a huge benefit for our profession. And a lot of pluses, especially in this age of the pandemic, because we can have pharmacists at a remote location logging into the EHR and verifying orders for our patients. If our systems are linked to our automated dispensing cabinets, our ADCs, then when the order is verified in the EHR, it goes to the ADC, and then the nurse can actually remove that medication for that patient. So definite benefits. But when I was first implementing some of these comprehensive EHRs at a number of different institutions, I did have some complaints from the pharmacists who felt that they were being taken away from clinical practice and being forced to sit at a computer for long periods of time, verifying orders, looking at all the orders that go through, verifying them, and dealing with the barrage of clinical decision support pop-ups that were happening every time an order was being verified. So I wanted to talk a little bit about this specific issue and go back. This is another in the Journal Club series. I wanted to look at an article that was written in 2009 by Alan Flynn. And Alan Flynn has been writing on the topic of pharmacy informatics for quite a while. And in 2009, he wrote an article which started some really spirited debates about pharmacists' review of orders. So he talks about NUPOR, which is nearly universal prospective order review by the pharmacist. So as you know, we need to verify every order, every medication order before the first dose of that medication is administered to the patient. Now, there are some exceptions, such as in an emergency department, where the provider is right there, they're present, and they can ask the nurse to get a medication and observe them administering the medication. And in those cases, it's considered legal for the first dose to be administered prior to the pharmacist's review of the order. But in all other cases, the pharmacist should be reviewing that order. Now, there's a cost to that, and the cost comes from other clinical activities that we could be doing, and we are not able to do because we are kind of chained to that computer of reviewing those orders. So when we do review an order, there's a lot that we look at, whether it's on paper or on the computer, and all these words on the screen here are really an excerpt from the article where he talks about minimally what we should be reviewing. But the important point here is, do we need to review all of this for every single order, including a DocuState order or a milk of magnesia order? Or is there a way to really risk stratify orders so that the most important orders that we need to look at, maybe the most dangerous drugs, drugs that have narrow therapeutic ranges for administration, ones that have contraindications for that patient, should we have a way to be able to risk stratify those orders and look at those orders first and then get to the other orders later? And maybe even have the computer auto-verify orders for us. So this is something that was kind of a new idea and caused a lot of controversy. And the question really came at that time, do we trust our computer systems? I'm a pharmacist and I have a pharmacist license. Do I trust my computer to be able to screen all the orders for me and automatically determine if they're good to go or not? And rely on that and just look at certain orders that might be a little bit more risky for that patient. And at the time in 2009, personally, I did not feel that our computer systems were sophisticated enough to be able to do this. Now, an article that Alan Flynn wrote, and he's written quite a few articles in between, but last year in 2019, he wrote an article on artificial intelligence, and one of the tools, machine learning. And in this article, when I saw this, I immediately thought of his Newport article and really thought about one of the areas that we have a lot of struggle with, which is clinical decision support. Our systems are not that sophisticated. We get a lot of false alerts on patient orders. And so I put the two together and thought, if we could apply artificial intelligence principles and tools in our EHR to our order review process, we might save a lot of time and really get to the point where we could trust our computers to verify some of the orders for us, especially some of the more innocuous orders, and then really focus in on the ones that really are most important for us to look at for our patients. So in this article in 2019, Dr. Flynn talks about potential uses for machine learning over the next 5 years. And as you see, he does mention drug selection decisions and dosing decisions. So we might say that he's thinking that we could apply artificial intelligence to our clinical decision support systems. In this statement from ASHP, there was a commission put together to look at artificial intelligence use in our healthcare pharmacy practice. And in this article, or this statement, again, the authors talk about identifying or predicting adverse drug events or reactions using artificial intelligence, drug-drug interactions, and risks of non-adherence. And then the latest article that I saw on artificial intelligence that I thought was pretty good was this primer on artificial intelligence, excuse me, that was just written a couple of months ago. And this one is a very comprehensive look at artificial intelligence and really gets us to think about what artificial intelligence is all about, what it might really be able to do or what it can't do, and how we might apply it to our electronic health records as a tool to help us with clinical decision support in other areas. So I hope this was helpful to get you thinking about our jobs as pharmacists and reviewing all medication orders for our patients and how we could use technology, how we can use our computer systems to really help us do that, and maybe free up some of our time to go and interact more with our colleagues, our fellow health professionals, and also with our patients to provide better medication therapy, better patient care. If this video was useful for you, then please like it and subscribe to my channel, and I'll thank you for that. In the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more Journal Club and other articles and other episodes, other topics. So stay tuned and hope to see you next time. Take care.